Welcome to SVG-TV News for Tuesday, October 31st, 2017. I am Jennifer Richardson with the details. A National Health and Wellness Commission for St. Vincent and the Grenadines was launched earlier today at the NIS Conference Room. The commission, which will serve for 3 years, is set to be broad-based, consisting of persons from the public and private sectors, non-governmental organizations, persons living with non-communicable diseases, faith-based organizations, and the media. While the main focus of the Commission is on non-communicable diseases, it will incorporate all areas of health, including communicable diseases and mental health. The aim of the Commission is to support the Ministry of Health, Wellness and the Environment in establishing health and wellness policies, responding to threats from communicable and non-communicable diseases, building capacity for community interventions, strengthening institutions, and ensuring timely interventions to address regional and international resolutions, commitments, and agreements. Chairperson of the Commission, Dr. Timothy Providence, says the Commission will serve as a coordinating body facilitating communication and collaboration among parties who may regularly exchange information and engage in joint action on healthcare matters.
The Commission will also function as an advisory body to Cabinet through the Minister of Health on related healthcare matters, hoping to influence policy decisions. Indeed, it would be rather nice if come World No Tobacco Day next year, that the Minister of Health could announce a ban on all smoking in public places.
It would be nice.
It would indeed be nice. So I think that is one area in which the Commission can probably function.
Welcoming the formation of the Commission, Minister of Health, Wellness and the Environment, Luke Brown, points out that non-communicable diseases, NCDs, continue to be the leading cause of mortality and morbidity in SVG, placing the highest burden on the country's healthcare system.
In St. Vincent and the Grenadines, 76% of deaths in the age group 30 to 69 were caused by non-communicable diseases in 2013. Out of that, 64% of them were caused by the 4 main non-communicable diseases, namely cancers, cardiovascular diseases, diabetes, and chronic respiratory diseases. Both hospitalizations and health center visits have increased significantly since 2009. In St. Vincent and the Grenadines, cardiovascular diseases occur primarily among men, while diabetes and cancers impact both men and women more equally. These facts, coupled with the evidence that modifying risk factors can largely prevent the onset and progression of non-communicable diseases, reinforce that the prevention and control of non-communicable diseases are a public health priority requiring urgent action. So it is a big problem, but it is not a problem about which we can do nothing. It's a problem that we could tackle head-on and see results.
According to the Health and Wellness Minister, a dedicated body like the Commission will help SVG to make further progress in the fight against NCDs and other diseases.
The significant need for an effective coordinated response that is multisectorial and addresses the social determinants of non-communicable diseases to strengthen healthcare for people, to develop enabling healthy environments, and to support healthy individual behaviors. In addition, there is a need for a radical reorientation of the healthcare system towards service delivery models for chronic care, as well as a strong focus on health promotion and partnerships with non-health sectors and communities. This reorientation involves strengthening the national primary healthcare systems to be able to take on a role in the prevention, early detection, and management of non-communicable diseases.
Vincentian women have been encouraged to educate themselves on cancer and get vaccinated against the human papillomavirus a known cause of cervical cancer. This encouragement comes as the Ministry of Health continues its campaign to sensitize the public on the issues surrounding HPV, cervical cancer, and the HPV vaccine. Speaking on the benefits of vaccination was gynecologist Dr. Camille Nichols, who stated that in larger countries where the vaccine is in use, there has been positive results, adding that all must be done to stop the deadly disease.
The studies have shown that it has made a big difference in countries where it's been used, for example, in the United Kingdom. I personally believe, and I've been a healthcare provider for over 25 years, working in obstetrics and gynecology, that cervical cancer is preventable. And if we can stem it, if we can find something to decrease the chances of cervical cancer, I'm all up for it. As I said to you, I have passed this information to my friends and family, and some of them have actually gone ahead. They've done their research and they realize that it is of benefit. Anything we could do to stop the scourge of cervical cancer will help us in St. Vincent.
Dr. Nichols said SVG has a very limited capacity to treat cervical cancer, noting that prevention is the best option.
When you get cervical cancer, it's gone, it's really late. In other words, we have missed the boat where we could actually help you. We do not have radiation therapy in St. Vincent. We do not have chemotherapy. Well, we have chemotherapy to some extent, but radiation therapy is not available here. The cost to do radical surgery, the cost to do radiation therapy is exorbitant, and most people cannot afford to finance that. And therefore, once it's like a death sentence, basically. And if we can stop or decrease cervical cancer, now with the vaccine and by doing regular pap smears, we are empowering ourselves as women to ensure that this disease can be eradicated in St. Vincent and the Grenadines. Parents, guardians, I implore you, prevent cervical cancer, save our Vinci girls, get them vaccinated.
Encouraging Vincentian women to have regular pap smears was medical practitioner Dr. Raquel Wilson, who stated that she was vaccinated 10 years ago and so far there has been no side effects.
Vaccination program that is going to be done by the Ministry of Health and the Environment in collaboration with the Pan American Health Organization. This gives us a chance to have our daughters be protected from the HPV virus and possibly contracting cervical cancer later on. I'd also like to encourage parents themselves to use this as a stepping stone as we are given more information about HPV and made more aware of it, to go out and have their regular pap smear screening. I myself took the vaccine about 10 years ago and had no side effects from it, and I would want to encourage you to take your daughters and also for yourselves to make sure that you continue doing your regular screenings or pap smears.
And SVG's Chief Medical Officer, Dr. Simone Kieser-Beach, said the Ministry of Health, Wellness and the Environment is highly concerned about protecting the public from harm and would not implement treatment which is harmful. Dr. Beach gave this assurance in relation to issues raised about the effects of the HPV vaccine. According to the CMO, the vaccine is designated to protect women and girls from cervical cancer, and that while she understands some of the concerns about side effects, she's encouraging persons to gather their research information from credible medical authorities, such as the World Health Organization, and to work hand in hand in protecting the nation's women.
That this vaccine has been found to have less side effects than some of the other vaccines we are given. All vaccines can cause a slight fever, maybe a little pain at the site of injection. Some people even faint before they get the vaccine because they're so afraid of the needle. But the fainting is not caused by the vaccine. So we want to encourage parents, guardians, friends, young girls. You're so savvy on the computer. Look it up. Look at good sites like the World Health Organization, WHO, PAHO, CDC. Look for studies that are not just one story, one person's impression, But look for sites, look for evidence based on the numerous persons who have received the vaccine.
Dr. Beach added that studies have proven that the HPV vaccine has borne fruit in protecting women from cervical cancer, noting that the Ministry of Health's aim is to protect the nation.
Over the last 10 years, thousands and thousands of persons have received the vaccines, and there are good studies out there which would give you the proper evidence of what the side effects are and the possible complications. The Ministry of Health is very aware of the concerns, and we do not want our family, our friends to be harmed in any way. And therefore we would not give you something that we know will do you harm. Rather, we want to do good, we want to protect you.
The Chief Medical Officer said as a mother, she will ensure her child is protected through vaccination.
We see the end results of persons who do not have, who have cervical cancer. We see the pain and the suffering. I am going to give my daughter the HPV vaccine when she is in grade 6, because I do not want my child to suffer or have any chance of having cervical cancer. Whatever I can do as a mother to reduce any potential suffering of my child, I will do. I will not knowingly expose my child to anything that I know is going to cause her harm. But she will receive the vaccine when she is in grade 6.
And Vincentians have been warned against the dangerous practice of ignoring and abandoning scientifically proven medicine and practitioners for those which have not been proven. This warning comes from President of the SVG Medical Association, Dr. Rosalind Ambrose, as she spoke on Magic 103.7 Sunday Brunch program, discussing various issues of concern in the medical field. Dr. Ambrose stated that while some medicinal herbs do have useful properties, they have not gone through the scientific processes.
There is a rift when a patient just abandons the medical practice which has a scientific, proven scientific basis.
Yes.
No one is disputing. I don't think physicians dispute that there probably are certain herbs out there. And not probably, there are certain herbs out there.
Yes.
But we have no proven scientific evidence that this works for that particular thing. Okay? So when a patient abandons the conventional, proven scientific treatment completely and begins to use the little bush in the backyard where you don't know what it is, you have no idea what the components of it are, you don't know what the complications of it are, and then you show up again at the doctor's office with your disease having gone 10 times further than where it was before.
Okay.
So the rift is really between what have you done to yourself versus what I'm trying to help you to do in terms of your survival.
Dr. Ambrose added that whilst there are some research on herbs that have medicinal properties in SVG, she said there is a vast difference between research and it being proven scientifically. She highlighted the example of one patient who paid the price for trusting unproven herbs.
He sort of disappeared, and then when I discovered him some weeks later, I can just visibly looking at him, I saw that there was more swelling on his body, but he then revealed to me that he had not been back to his conventional, medically, scientifically proven physician, that he had actually stopped that medication and was now seeing a herbalist who told him, oh boy, that's just an infection, take this instead. And he sadly died. So that is abandoning completely the conventional medicine. That is definitely not recommended. I don't want to say that you can take that alongside your herbal, because I don't know what's in the herbal thing, so I cannot encourage that. I can only reinforce that when you are being treated, and whether it's diabetes, hypertension, or any other more serious disease or complication of those diseases, I would not recommend that any person, quote, abandon, meaning to give up completely, flush your tablets down the toilet. Do not abandon your basic scientific medicine.
Dr. Ambrose used the example of another panelist present on Sunday's program who is living proof that conventional medicine can save lives after a diagnosis of cancer.
Some of them materialized, some of them did not. So pleasantly for you, you felt, well, gee, I didn't get that one. But you had an idea of what was going to happen. And I think for a vast majority of people, not everybody, but increasingly more people who are having to undergo chemotherapy, well, we're in the information age, are reading about it, and now that survivors talk to each other more. And the gentleman did ask about, do people really survive? And the answer is absolutely yes. Gloria is sitting there as a living, breathing, healthy young woman, and there are many, many more like her from other different types of cancers. And as I said, there are people who go to work every day, they're on the job, they go to their treatment, they go back again, and so we really are in a better state of how the treatment systems.
This country is expected to see increased arrivals by sea and air within the next 2 months of the year. At a media conference today, Minister of Tourism, Sports and Culture, Cecil Sesmaki, says the July figures show that arrivals by sea have increased by 4.2%, and that number is expected to increase over the next 2 months. Mackey noted that so far, 315 calls by cruise ships have been identified, which will go up to April next year. He said this is an increase of 23% over last year's figure, which was 256 calls.
In terms of full capacity, we would have seen quite a large increase in terms of the capacity, the full capacity. If the ship comes to St. Vincent full, those numbers are quite higher than they would have been last year. Last year we welcomed the Britannia for the first time, and they did, I think, about 7 calls last year. This season they're doing 10 calls to the destination. Their capacity is 4,000 passengers and 1,700 crew. And this year we're also going to welcome Fantasia, which is a larger vessel, 4,300, just over 4,300 passenger capacity and 1,800 crew. And they are also going to make 10 calls to the destination. So that should just give you an idea of what is going to unfold for us during this year's cruise season. It means that the capacity in terms of the land tours, etc., will be challenged, and therefore we are asking Vincentians to respond positively, work with the agents. They will identify what is required. Cabinet is willing to offer incentives to persons who wish to get new vehicles to be able to assist with the movement of persons with this increase.
As it relates to air travel, the Tourism, Sports and Culture Minister says the first charter flight for the season by Sunwing arrived here on October 23rd, and these flights will continue every other week into January 2018.
Month of December, we can report, is either filled or over 80% filled in terms of those charters. So that's why I indicated that December is going to be a good year and a good month and to end the year. And also the scheduled flights by Air Canada, the first one on the 14th of December, that's completely filled. The second one on the 21st, I think, of December, that's about 85% filled, and those flights would go into April next year. Sunwing will end in January and then pick back up when Air Canada ends in April. And I also want to say that Easy Sky, they continued their weekly flights into St. Vincent and the Grenadines. For the month of October, one of the flights, 74, the next one was 65, and one should be coming in this week with 82 persons. Those flights come from Cuba to St. Vincent and then back to Cuba, and the persons come really to shop. So it's a shopping tourism at its best and going in St. Vincent and the Grenadines, and we know that the shoppers are visible on the streets of Kingstown, and we're happy to facilitate that type of tourism, which is now of growing interest to us here.
At today's media conference, musician and conservationist Hayden Billingy took the opportunity to speak on his song Good Times, which speaks of the beauty of SVG as the ultimate destination, not only for visitors but for locals to explore.
Many artists would have sung about our island, including the famous Beckett and others, and they would have captured the essence of our culture and our nature and our beauty. But I felt I was captured through the eyes of a reggae. And, you know, this is basically an islander saying to people within your island or those abroad, welcome to St. Vincent and Grenadines, welcome to the island that is still unspoiled, that have not been explored, places you have not seen yet. Even Vincentians would not have traveled St. Vincent widely because of different reasons. There are persons who have not gone to the Grenadines, have not gone to Tobago Keys, have not gone to Mopian, have not gone to Union Island, and you are missing out on an opportunity to discover your country and the beauty that it possesses. And I want to encourage persons, nationals, regional persons, and international visitors to welcome them to our beautiful islands. And this is a package deal, 32 islands and keys. It has all you would ever need. Waterfalls, you can dive, you can sail, you can just kick back and relax and have a good time.
Governor of the Eastern Caribbean Central Bank, Timothy Antwine, last Thursday, October 26th, hosted a discussion with media practitioners here as part of the bank's citizen engagement and stakeholders relations strategy. During his presentation, the governor pointed out that given the recent hurricanes, the outlook for the ECCB economy is generally positive, but significant transformative reforms are required to elevate the current growth and employment trajectory. He said given the vulnerability of the region to natural disasters and external shocks, building resilience is essential and must be central in all macroeconomic and development policies. The governor gave the assurance that the EC dollar remains strong and stable, noting that as of October 20th, the currency was back to 98.1% above the required 60%.
So as you can see, we are well backed. And I might add, notwithstanding the storms and the hurricanes, we continue to have a strong currency. This is a currency that has weathered many storms and hurricanes along the way. And so it has proven to be resilient over time, and long may that continue, and we must work together to ensure that that continues.
In terms of growth, he said the performance is disappointing and below target. However, it is not all bad, and that if member states wants to get into the top 50 of Ease of Doing Business Index, they need to tackle getting credit, registering properties, resolving insolvency, and getting electricity that is cheaper.
And I want to say on the issue of access to credit that what we are working on with our governments is a partial credit guarantee scheme. And St. Vincent and Grenadines has already passed that into law. 4 other countries, which means a total of 5, have passed it in the ECCU. So we are going to be getting ready to move forward with the implementation of that partial credit guarantee scheme. The second initiative I want to mention is the Credit Bureau. And again, we are expecting, 2 of our countries have already passed it. We're expecting others to pass it in the next couple months, next few months, and then we will be able to work towards a long discussed goal of having a credit bureau, which will help with access to credit and credit underwriting. And then the other initiative I want to mention on this doing business issue is the matter of a modern land registry. St. Vincent and Grenadines has applied to the World Bank, along with some other countries in the ECCU, for support to establish a modern land registry. And those will help with ease of doing business, especially as it pertains to registering property.